Over the last decade, there's been a shift in the management of renal trauma, favoring observation for high-grade renal injury in hemodynamically stable children. Given this, we conducted a study hypothesizing that there has been a significant decrease in rates of surgical intervention in pediatric high-grade renal trauma compared to historically reported rates. Using a large claims database, we conducted a retrospective cohort study looking at pediatric patients presenting with renal trauma. We used AAST grading to categorize renal injuries as either high grade or low grade, and we then analyzed clinical outcomes and practice patterns for evaluation and management strategies. We specifically looked at initial and subsequent surveillance imaging modality, management within 1 week of the initial trauma event, and long-term sequelae from 1 month to 5 years after the trauma event. We included nearly 2,000 patients in our study, and unsurprisingly, we found that patients with high-grade trauma were more likely to undergo subsequent imaging after initial ultrasound and CT scan compared to low-grade trauma patients. Observation was the most common management strategy in both groups, but those with high-grade renal trauma were more likely to undergo ureteral stenting, transfusion, IR embolization, and surgical intervention. In terms of long-term outcomes, we found that patients with high-grade and low-grade trauma had similar rates of consequent hypertension, CKD, and psychological sequelae. Finally, compared to historical series, our study demonstrated significantly lower utilization of surgical interventions overall in the management of pediatric renal trauma.